Hi, welcome back to video 20 of the series of staying healthy and preventing COVID-19 infection during the current pandemic. So in this video, we are going to look at the relationship between vitamin D, COVID-19 and see how vitamin D could prevent the disease. So let's have a look at what do we know about these things as of today. The things can change. Science is advancing. So many observational and ecological studies provide evidence that having serum 25 hydroxyvitamin D concentration between 30 and 50 nanograms per mil, that's 75 and 125 nanomoles per liter, positively modify a variety of health conditions, including a number of more than actually 200 gene modifications. Studies also confirm that the concentration below 20 nanograms per mil, which is 50 nanomoles per liter, significantly increase the risk of several key disorders, including cardiovascular disease, autoimmune disorders, cancer, diabetic mellitus, and other metabolic disorders. So, data from randomized controlled studies are generally considered as necessary for accepting for drug approval, nutrients, and some novel treatments or procedures as effective tools. However, as with the other nutrients, vitamin D randomized controlled trials in the recent days, especially over the last few years, had been significantly flawed. Virtually every study had a major study design failure, making their conclusion really cannot be extrapolated to other than their own study. So it's unfortunate because some of these studies have spent over $40 million of taxpayers' money, yet their study has a significant, very fundamental flaws in the study. So in fact, for example, things like the baseline serum 25 concentration in this study subject have been too high. In fact, more than 30 nanograms per mil in some of the studies. So somebody with adequate nutrition, you cannot make them better by giving more nutrients. Honestly, it's a stupid thing to do. So the nutrients should be given as a controlled clinical trial to the people who are deficient. Then you can very easily demonstrate the effect of nutrient supplements, including vitamin D, and their benefits on the primary and secondary outcomes in these patients or subjects. So at least the proportion of the subjects, these levels are high as 30 to 40 nanograms per mil, diluting the value of these studies. Secondly, virtually most studies, and most like 90-95% of the studies, in addition to lack of baseline data, they failed to measure the level of 25 hydroxyvitamin D achieved during these large, it's called the mega trials also. So conclusion again cannot be derived by just measuring, knowing how much vitamin D they supplied, or any nutrient for that matter. You need to know how much actually the blood level they achieve. That's the only way to conclusively say that the patients had taken the medication and the dose is adequate and absorption was as expected. The other studies had that vitamin D dosage were too low or administered too infrequently, sometimes every 3 months, 6 months, or some studies even once a year. Make no sense at all knowing the physiology of vitamin D. The best way to administer the vitamin D is the daily. But once a week will definitely work, and once in 2 weeks also works, but anything more than once a month, it really has little effect of beneficial effects. So in almost all studies, the serum 25 concentration achieved the following supplementation were not measured. So it's basically worthless. So let's look at the importance of the balanced diet on maintaining good health. Again, one of the previous videos we addressed the issue of the nutrient, particularly the micronutrient on this aspect. So let's summarize that on this one. So having a balanced diet, especially with adequate quantities of micronutrients, smaller quantities of the minerals, vitamins, and trace elements you are going to need, such as vitamin D, E, K, K2, C, trace minerals, and indeed antioxidants will lead to maintenance of a strong health, especially the stronger immune system. In most countries, if you look at it, certain communities and ethnic groups have one or more prevailing micronutrient deficiencies, either in part due to genetics and mostly due to available food and dietetic taboos. So, these communities with the micronutrient deficiencies have an increased vulnerability to various disorders, including the metabolic disorders, as well as both communicable and non-communicable diseases. In addition to nutrient supplementation, food fortification with vitamin D, iron, and other micronutrients is a good way to supply the missing micronutrient to a larger targeted community, and this will have a highly cost-effective impact on the overall health and indeed disease prevention, which is the number one thing to do. So let's look at how much vitamin D is needed to boost the immunity, especially in the era of COVID-19 pandemic. So taking smaller doses like between 400 and 2000 international units as advised by most physicians might take several months or even years to build up the necessary concentration in the blood and the tissues to have a meaningful impact on immunity. Variations are based on the genetics and also depend on the body mass index, which is how much fat people have in their bodies, and several other factors. Whereas larger doses can rapidly build up a serum 24-hydroxyvitamin D and indeed the conversion to active hormone, which is calcitriol, and thereby building the immunity quite rapidly. In fact, that can happen within 3 to 5 days. So this immunity can be available swiftly for prevention of respiratory tract disorders, in particularly even at these epidemic situations. So there are multiple regimens one can take to reduce the risk of infection. For example, taking vitamin D 10,000 IU per day, that is 250 micrograms, for a few weeks, or 50,000 international unit capsule, which is available, taking once a week, or take the mega doses, which is for 400,000, 600,000 international unit as a single dose, can protect a person for as long as 12 to 20 weeks from these coronaviruses. Nevertheless, whatever the dose and the frequency of administration, the goal is to increase the serum 25-hydroxyvitamin D concentration above 14 nanograms per mil, which is equivalent to 100 nanomoles per liter. For treatment of people who have been exposed to a person with COVID-19, or those who are in the quarantine centers, or those with the COVID-19 infection, positive by blood test or the throat test, higher vitamin D doses, such as a single dose of 400 to 600,000 units, are recommended to rapidly increase the serum concentration of vitamin D to boost the inherent or innate immunity. The quarantine centers also can use the above protocol of administering capsule for 4 capsules for 250,000 units on admission, which followed up by 1 a day for 8 days. So all these regimens should be beneficial by us. Should be maintained and follow up by the daily doses of smaller vitamin D oral supplementation. Another complementary approach is to mandate the food preparers in the country and manufacturers to fortify the certain staple food items with micronutrients, especially in the COVID era with vitamin D, until the outbreak is over at least. And the specified amount for these fortifications should be at least 4 to 6 times higher than the standard amount recommended in the normal times. The goal is to bring the serum 25-hydroxy concentration in the population to about minimum of 30 and ideally about 40 nanograms per mil, which will protect them significantly against the COVID-19 infection. Even if they get infected, as I know several of my friends in the U.S. and in the United Kingdom, they actually saved their lives because they were taking higher dose of vitamin D. So this is a very cost-effective infection, giving the food fortification to target population. So therefore, it suggests that a nationwide campaign must be launched, which doesn't cost anything, immediately strengthen the immunity of the entire population. Combination of vitamin D supplementation and easily with a safe sun exposure, as we discussed in the previous video. So this can be achieved cost effectively by proper guidance on sun exposure, supplementation with vitamin D, and targeted food fortification. So none of these are expensive things to do. So now you are very much aware of the beneficial effects of vitamin D, and you know that how to replace vitamin D or supplement vitamin D in COVID era, and I hope that you take action to protect yourself and your family. So with reference to viral mediated respiratory infection, you need to build up your immunity as soon as possible, as I indicated, as well as the two videos kindly done by Wimalawansa, which is I just uploaded yesterday. So in the next video, I will discuss how vitamin D reduces the risk from COVID-19. So watching the previous two videos are very helpful to understand, as because from next two videos I'm going to go a little bit more deeper on scientific aspects, so that you really understand how vitamin D helps and also how COVID attacked this lung cell and killed people. Till then, thank you. Have a great time. Bye.